Hi everyone, my name is Diana Bermejo and I will talk about the toxin or methamphetamine hydrochloride. So, what is the toxin? The toxin are tablets that subject to control under DEA. They're scheduled to medication, so that means misuse can be illegal. The toxin, or his generic name is methamphetamine hydrochloride, is a chemical known as dimethylbenzphenethanamide hydrochloride. It's a member of the amphetamine group of sympathomimetic amines. I hope I pronounced right that. So, the toxin is used to treat obesity. However, methamphetamine has a high potential for abuse. It should just be tried only in weight reduction programs for patients. The patients has to be 12 years older and only prescribed as a doctor orders. Also, the toxin is a prescription medicine used to treat the symptoms of attention deficit hyperactivity disorder or ADHD as a treatment for children 6 years or older with a behavioral syndrome characterized by moderate to severe distractibility. The toxin belongs to a class of drugs called CNS or stimulants, anorexians stimulants. So how it works? The toxin is a derivative of amphetamine. A lot of people call the legal methamphetamine. It's a CNS or central nervous system stimulant. It works by changing the amount of the certain natural substance in the brain. The toxin increases dopamine levels in the brain, so it can help increase your ability to pay attention, stay focused on an activity, and control behavior problems. The toxin increases or promotes euphoric feelings of excitement and well-being. Also triggers increased alertness. So, why is this so addictive? Well, for example, what is a dopamine? Dopamine is a neurotransmitter that helps control the brain's reward and pleasure centers. To see how the toxin is addictive, so during sets, dopamine levels spike to 200%. This is why it increases some pleasure levels. Using cocaine as a stimulant, the bumps those levels of dopamine by 350%. That's a lot. But the toxin, aka methamphetamines, by far is the most powerful stimulant and is also the most frequent abuse during misuse. Dopamine levels skyrocket up to 4,000%. This is why it can be highly addictive. So here is effects of methamphetamine. As we can see, this shows a physiological and psychological effects in the body. What are the side effects of the toxin? Well, the toxin is a potential side effect of this prescription methamphetamine stimulant are painful, ranging from mild to severe. They can cause addiction, dependence, tolerance, drug-seeking behavior, as insomnia, irritability, weakness, dizziness, headache, tremors, palpitation, cardiac arrhythmias, and hypertension. So the basic consequence of the toxin abuse. The most noteworthy difference is the strength. As I mentioned before, is a 4,000% more addictive compared with only 350% as the cocaine. The toxin is more potent than the Adderall and Desoxyn. Those two drugs, they are also CNS, so central nervous system stimulants, and these effects that the toxin can last up to 8 hours. The toxin use can lead to a number of potential dangerous side effects, even when the substance is taken as a prescribed. Can increase blood pressure and raise heart rate, can cause a stroke and heart attack, seizures, and numbness, or feeling cold in the fingers, toes, ears, and nose. With a chronic or longer term, the toxin use or abuse, users may face additional health risks, like children that consistently use the substance for a long period are subject to a long-term suppression of growth. Other side effects of long-term use or abuse including shakiness, confusion, insomnia, change in mood, anxiety, paranoia, and delusional thinking. Also, auditory, visual, and tactile hallucinations, violence, extreme weight loss, stroke, heart attack, and death. So this is the end of my presentation. This is the reference I used. So I'm apologize for my strong accent, and thanks for watching.